CMAJ October 23, 2017 Volume 189 No. 42 doi 10.1503 CMAJ.161298 Roberto Magli, MD, Marzia Caproni, MD Department of Medical and Surgical Critical Care, Section of Dermatology, University of Florence, Florence, Italy. Correspondence to Roberto Magli, magliaroberto78@gmail.com. See related article at www.cmaj.ca. Lookup doi 10.1503 CMAJ.1707568 A 21-year-old woman was admitted to a general medical ward with a 3-year history of self-limited episodes of bleeding from her palms and face despite no evidence of skin lesions. There was no obvious trigger for the bleeding, which could occur while she was asleep and during times of physical activity. She stated that more intense bleeding occurred during times of perceived emotional stress. Episodes lasted from 1 to 5 minutes. Our patient had become socially isolated owing to embarrassment over the bleeding, and she reported symptoms consistent with major depressive disorder and panic disorder. There was no history of psychosis. Our differential diagnosis include factitious disorder and an uncommon condition known as hematohidrosis. Laboratory investigations Appendix 1, available at www.cmaj.ca. Lookup Apple doi 10.1503 CMAJ.161298 DC1 including a complete blood count and coagulation studies. Prothrombin time, activated partial thromboplastin time, fibrinogen and D-dimer were normal. Appendix 1. We found no evidence to support a diagnosis of factitious disorder. We treated her depression and anxiety disorder with paroxetine and clonazepam, but her bleeding continued. During admission, we observed the discharge of blood-stained fluid from her face. Figure 1a and Figure 1b. Based on the presence of erythrocytes on microscopic examination excluding disorders that induce colored sweat secretion, such as chromhidrosis and pseudochromhidrosis, we diagnosed hematohidrosis. Histologic analysis of the skin in an area of bleeding was normal. Figure 1c. Figure 1 bleeding discharge from the forehead A and lower face B of a 21-year-old woman. C. Histologic analysis from a bleeding area showed normal skin without any relevant histopathologic changes. Hematoxylineosin stain, magnification times 20. Hematohidrosis is an uncommon disease characterized by spontaneous discharge of blood sweat through intact skin. Point 1. Various causes have been proposed, including systemic diseases, such as vicarious menses and coagulopathies, albeit historically reported in malaria, scurvy and epilepsy, exertion and psychogenic disorders, one in which bleeding might be the result of exacerbated sympathetic nervous system activation. Point 2. In the literature, there is no single explanation of the source of bleeding in hematohidrosis. Despite the fluid sweat-like appearance, the hypothesis that blood passes through eccrine ducts, induced by abnormal constrictions and expansions of paraglandular vessels, has not yet been proven. Point 3. Bleeding has also reportedly occurred through areas without sweat glands. 2. Or through the follicles. 3. In the presence of dermal defects leading to blood-filled spaces exuding via follicular openings or directly into the skin surface has also been proposed. Point 3. We treated our patient with propranolol 20 mg day, based on its use in similar cases in the literature. 3. And this led to a marked reduction, although not a complete remission, of her bleeding. Footnotes. Competing interests. None declared. This article has been peer-reviewed. The authors have obtained patient consent. References.